Hi there, my name is Sarah Kirsch, and I am a research assistant with the Department of Anesthesia and a master's student in the Health Research Methodology program under the supervision of Dr. Dana Zaradkar. My poster describes a systematic review addressing the consideration of values and preferences in COVID-19 public health guidelines. In the wake of the COVID-19 pandemic, governments implemented policies that were informed by public health guidelines. For guidelines to be considered credible, they must adhere to certain standards. Considering public values and preferences, defined as the public's perspectives, beliefs, expectations, and goals for health and life, is internationally recognized as a critical component of credible guideline development. Early anecdotal reports, however, suggest that public engagement was limited and suboptimal in COVID-19 public health guidelines. To capture and characterize whether and how public health guidelines considered values and preferences, we performed a systematic review of COVID-19 public health guidelines. We searched the eCOVID RecMap platform, a comprehensive open-access digital collection of COVID-19 guidelines and recommendations, up to July 2023. We included guidelines that made recommendations about interventions at the population level or interventions that were motivated by population effects. We reviewed 617 guidelines for eligibility. Of these, 129 proved eligible. Our flowchart shows the reasons for excluding guidelines. Of 129 guidelines, only 26 of these considered values and preferences. The most common reasons for considering values and preferences were to weigh the anticipated benefits of harms of alternative courses of actions and to consider the acceptability of the recommendations. The methods used to consider values and preferences most commonly involved referencing existing literature. Guidelines did not perform or reference reviews of literature on values and preferences, and rarely did guidelines engage laypersons as part of the guideline development group. Failure to perform systematic reviews of the literature may result in cherry picking. In conclusion, most public health guidelines did not consider values and preferences, and when they were considered, it was suboptimal. This disregard for values and preferences may have contributed to divisive or unpopular pandemic policies. Our results may be explained by the context in which these guidelines were developed. During the COVID-19 pandemic, guideline developers were forced to produce guidelines quickly during unusual circumstances. While the COVID-19 pandemic was unprecedented, we anticipate other health emergencies that will also benefit from guidelines that are aligned with societal values. We recommend future research identify efficient methods for considering values and preferences in health emergencies and crisis situations. Thank you for listening.